This year, more than 16,000 Americans will be diagnosed with cancer of the esophagus, a deadly disease that starts with something as common as heartburn. And for patients, early detection can be the key to survival. Dr. Steven Steinberg of Boca Raton Regional Hospital is here to tell us much more, and April is Esophageal Cancer Month.
It is, Mike.
Thank you so much for joining us. What is esophageal cancer and what causes it?
Well, Mike, the esophagus is the tube, as you know, that goes from the mouth and brings food down into the stomach. And so there are two types of cancers of the esophagus. One that used to be more prevalent, that was highly related to smoking, and another, as you alluded to, is related to prolonged heartburn, which is to say usually more than 5 years, and the changes that occur in the esophagus when the esophagus is exposed to too much acid. And so in that situation, people get a change in the lining of the esophagus, and that change in the lining also carries with it a small but very present risk of proceeding to a cancer.
Perhaps there's somebody listening in thinking they have the symptoms right now. So let's define the symptoms of this type of cancer.
Well, sure. So heartburn isn't a symptom of the cancer. It's a symptom of the acid coming back in the esophagus. And again, if somebody's had that for more than 5 years, they ought to see their gastroenterologist to make sure that they don't have the changes. And I don't want to alarm people too much, right? There's a tiny risk. It needs to be attended to. When people have more advanced disease, they may experience difficulty in swallowing because there's an obstruction to the passage of food.
You mentioned visiting a specialist. What are the different type of treatment options?
Well, for advanced disease, we look at things like surgery and drug treatment and radiation therapy. But what's relatively new, and only in the past 2 years, is that for people who have very early disease, whereas we used to operate to take out the esophagus, we can actually now do some specialized endoscopic procedures, scope procedures, where we can remove the cancer as an outpatient and literally have the same results as we used to get by a much more significant operation.
On the road to recovery after that, what is the general prognosis of this type of cancer?
Again, it depends, as with all things, what stage and what the time you catch them at. For those early tumors, we do very, very, very well, in excess of 90% survival and cure rates. For those people with more advanced disease, it's not as good, and we have some work to do.
Okay, and if we're talking about how you can stay away from the heartburn, leading up to this, any kind of preventative measures that you could say?
Well, I think the preventative measures are, one, to eat healthy and maintain an appropriate weight. That actually helps with heartburn. When people do have heartburn, that oftentimes represents a mechanical problem at the end of the esophagus, and there are things that can be done for that. Okay. I think that the take-home message probably is that people should view this as a health maintenance issue, not as a, if I have heartburn, I'm going to get cancer issue.
I see. Interesting.
They should see their gastroenterologist, because all gastroenterologists are pretty much specialists in this particular problem and can certainly advise them as to their risks.
Absolutely. You want the best care when you need it. Thank you very much, Doctor, for joining us, and all that information at Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segments.
At home, at work.